Yeah, can
Please
I start?
start.
So, good afternoon, everyone, and thanks to AIOS for giving me this opportunity. I'll be talking on the real world the treatment of neovascular AMD with intravitreal aflibercept, and we have titled this presentation as Vision, where we are going to be talking about the vital insights on the strategies and outcomes in real world neovascular management of AMD in India. And when you look at aflibercept has basically now become the gold standard or the first line treatment in neovascular AMD. And when you look at these clinical trials which start comparing the newer anti-VEGF molecules such as brolucizumab and the faricizumab molecules, the gold standard or the comparative arm is always aflibercept 2 milligram. That is because it has become the gold standard treatment, and therefore you are now comparing it with aflibercept 2 milligram. But there is the real world data on the usage of aflibercept is very scarce, both from India and globally. And therefore, we wanted to do this study where our primary objective was to look at the real world outcomes of patients treated with intravitreal aflibercept in the management of neovascular AMD from a single center in South India. This was a retrospective study, single center of Narayan Nethralaya, where we included only neovascular AMD cases treated at least with one injection of aflibercept 2 milligrams with a minimum follow-up of at least 1 month post-treatment, and both including treatment-naive cases and previously treated or treatment-switch cases over a long period from January 2019 to December 2024. The exclusion cases were obviously cases with diagnosed or confirmed cases of PCV on ICGA, eyes where injection was advised but it was not taken, and cases where either they had no follow-up or follow-up less than 3 weeks duration. Now let's come to the results itself, and this was basically, you had 351 eyes of treated with intravitreal aflibercept for neovascular AMD, where 2 eyes had follow-up less than what was the recommended thing, and therefore we excluded them from the study. So eventually you had 349 eyes of 331 patients having treated with 1,254 injections of aflibercept 2 mg. The mean number of injections were around 3.7 with a range from 1 to 23. Now, out of these 1254 aflibercept injections, which was given over a 6-year period for neovascular AMD, 268 injections actually had follow-up visits less than 4 weeks, which were less than the recommended 4 weeks. And therefore, the analysis was only done for those 986 injections which had a follow-up of greater than 4 weeks between the 2 injections. In 181 aflibercept injections, the aflibercept was given following a treatment with a previous anti-VEGF injection. And if you look at this graph, it clearly tells us that the poor response was basically to ranibizumab, both the innovator molecule and the biosimilar molecules in almost 74% of the cases. Now let's look at the reason for switching in these 181 injections, and you would realize that no response to the previous injection was seen in 63 cases, 63 injections, and we also wanted to achieve a longer duration in around 30 cases. Now let's talk about the efficacy in these 986 aflibercept injections, and you would realize that over a period of more than 5 years, the CSFT reduction was maintained between the baseline and the last follow-up visit. Within the observation period, the CSFT reduced significantly over the first 3 months, and then it was maintained over the next 5 years. Even the visual acuity, if you look in terms of the ETDRS letters, was maintained in cases who had more than 5 years follow-up between the baseline and the last follow-up visit within the observation period. Now let's look at the fluid reduction which we had in the different compartments, and you would realize that over the follow-up status, the change in the fluid improvement was more so with the pigment epithelial detachment and the subretinal fluid, whereas the intraretinal fluid was almost the same in these follow-up patients. Now let me show some few cases. This is a 64-year-old male complaining of blurring of vision with a visual acuity of 6/15, had been diagnosed with both eye MACTEL but ended up with a left eye AMD CNVM, where you could see that there is a pigment epithelial detachment, there is a flat irregular PD, and then subretinal fluid as well. And this is what the patient was treated over the next 4 years, where in 2023, 2 years after the baseline visit, the patient presented with a massive submacular hemorrhage for which he underwent vitrectomy with subretinal TPA and intravitreal injections. And this is at the last follow-up visit a couple of years later, where he is maintaining with multiple aflibercept injections a visual acuity of 6/18 at the last follow-up visit. Let me show you a case of peripapillary PCV. The reason for showing up this case was to show you the regression which we achieve with aflibercept for the polyps. So this is the pre-treatment FFA-ICG, which is actually showing the presence of the peripapillary polyps and the polyps which are present nasal to the fovea, infranasal to the fovea. And this is after the 3 injections of loading doses of intravitreal aflibercept, where the hard exudation has reduced significantly and the PED heights have reduced. And what you can see in the pre-treatment and the post-treatment FFA-ICG is the regression of the polyps which we achieved after the treatment. Now let's talk about the durability of the drug. And to assess the durability in a real-world scenario, we took cases with eyes greater than 2 years follow-up duration, treated only with aflibercept after it was initiated. We documented the visual acuity and the central subfield thickness at each visit, and also the fluid status in terms of PED, subretinal fluid, or intraretinal fluid at each visit. So we basically had 37 eyes who met this inclusion criteria with 637 visits. And if you look at the total follow-up duration, which was available between the first and the last aflibercept injection, it was around 4 years. And if the median interval between the 2 injection visits was around 7 weeks, and the mean number of injections of aflibercept which was taken over this cohort of cases was around 9.2. Mean number was around 9.2 with a standard deviation of around 4.7. Now, what's interesting in this is that we looked at the percentage of cases where you could at least achieve a follow-up duration between the 2 injections of around 12 weeks and 16 weeks. And you would realize that almost 100% of the cases ended up with a follow-up interval of greater than 12 weeks and 95% or greater than 16 weeks, at least once in this observation period. Let me showcase another case of a neovascular AMD treated with the TREX regimen. It's a treatment-naive neovascular AMD presenting in a 60-year-old female who complained of blurred vision since 1 month. She's a diabetic and a hypertensive, and a presenting visual acuity of 6/15 in the left eye. And what you could see is that there is a type 1 CNVM with subretinal fluid. And following this first injection itself, there was a resolution of the fluid. This patient was put on the loading dose with a 3-injection loading dose. And with this injection dates, we could achieve an extension of around 12 weeks between the 2 injections with the treat and extend regimen in this patient, with the visual acuity being maintained at 6/9 at the last follow-up visit. Let me showcase another case of a 68-year-old gentleman who is an ex-army person with a visual acuity of 6/9, presenting with a type 1 CNVM with subretinal fluid and a subretinal hyperreflective material with 3 loading injections. You could see that the subretinal hyperreflective material and the fluid has totally resolved. And this is over the treat and extend regimen, where you are looking at a complete resolution with a maximum treatment-free interval of at least 16 weeks between the 2 injections. When you looked at the safety, we did not encounter any case or any eye who developed a significant vision-threatening intraocular inflammation with intravitreal aflibercept. So let me just conclude and say that intravitreal aflibercept is the most preferred treatment drug in the management of neovascular AMD, even in the real-world settings. The aflibercept achieves a reduction in central macular thickness and subretinal fluid and pigment epithelial detachment resolution. The visual acuity did not change much following the treatment, which is expected with most of the NAMD cases. And the highlighting point is that we need a proactive and an aggressive treatment regimen, even in the real-world practice, to achieve the maintenance of the visual acuity and even improvement.